If you're taking the CPC exam in 2021, either online or in person, I have got for you all of the tips, what to expect, how to nail those questions, the breakdown of the exam, and even the critical changes of how they're going to test you on evaluation and management coming on up. Hey, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in your medical coding career. Today I want to talk about passing the CPC exam in 2021. Now I have a series of videos that you can check out on passing the CPC exam in 2020, and they're still very, very relevant. A lot of the exact same things are going to be tested, but I just want to talk about the changes in 2021, and then also for our 2021 students, just refresh all the stuff that you need to know for the exam, both online and in person. One of the really crucial things in 2021 is going to be making sure that you read all of the emails that the AAPC sends you, whether you're taking it online or in person. So if you're taking it online, they're going to give you a listing of all the setups that you're going to need, what you can have on your desk, how to have a quiet workspace, where your webcam needs to be, what kind of webcam you need, which is basically an external webcam. It can't be like a built-in laptop webcam. And they're going to give you information about where to log in and what to expect. So it's really, really important that you read through very carefully that email. With the in-person, they're going to tell you where to go, and you need to make sure that you know exactly where you're going to go and that you're going to be there on time. Both online or in person, you have to make sure you're there on time and that you're prepared. Do things like have your books ready ahead of time, have your laptop cameras disabled and your external enabled ahead of time. Make sure that your space is clear if you're taking it online. If you're going in person, make sure that you know where you're going and you get there in advance. With the in-person exam, once they start the exam for the rest of the attendees, they close the doors and no one else is admitted. So it's very, very crucial that you're in there on time and that you have everything ready, your books, your photo ID. Actually, what I'm going to do is I have a checklist. I'm going to drop that in the comments. So if you want to download that for the day of your exam so you can check off and make sure that you have all of the things you need, that'll be a really very handy tool for you. So for the in-person exam, you're going to need your ICD-10, your CPT, which has to be the AMA edition only, your HCPCS book, a number 2 pencil. It's better to bring a dull pencil because that'll help you fill in the little bubbles a little bit quicker. Make sure you have extra pencils, a sharpener if you're afraid you won't have access to one. Highlighters sometimes, those can be very helpful for your process of elimination things. I used them for my COC exam. There were certain questions it really helped out with. Also make sure you have your photo ID. You don't need your member ID number because there's going to be your member ID on your exam packet, but you do need your photo ID to prove that you're the right person taking the exam. In either setting, you have to give yourself an attitude for success. Envision yourself passing the exam. Don't stress too much. Don't overthink things. Just envision that you've already passed the exam. Kind of think about your name with that letter CPC right after it. Now, that does not mean I'm telling you to just wish or envision yourself to be a CPC. You have to do the work and do your studying. And I'm going to tell you a little bit more first, though, about the exam breakdown before we get into some actual questions. Now, for the in-person exam, they will give you a test booklet, and it's shrink wrapped. So in there will be your exam as well as a bubble grid for you to fill in with all of your answers. Now, there's strict instructions that they're going to go over with you, and they're available. I can put them in the description below of what the proctor to examine instructions are so that you can kind of see what they're going to say to you when you go in for the in-person exam. But basically, they're going to give you instructions to undo your shrink wrap, and you're going to take your shrink wrap off. It's sometimes a little bit difficult, but be very careful because there's going to be a little sticker here on your shrink wrap that has your member ID number and your exam number on that, and you have to fill that out in your bubble grid. So when you take off that shrink wrap, don't throw it away because you need that sticker that's on there. Basically, they're going to start reading the exam instructions to you, and they'll have you start filling out some sections in this grid with your name, your examination number, which is on that little sticker in the shrink wrap. Your member ID number is on the sticker in the shrink wrap. They'll have you fill that in. There's also here about if you've done any distance learning, how much years of experience you have, your proctor's names. So that all has to get filled out. Once everyone is done filling that out, they'll say there's actually gold seals on your exam book, and they'll say, okay, now you can rip open the gold seals. They're on each corner. And then you rip those open and they'll say you can start the exam. There's also another set of stickers that will be in the shrink wrap that when you're done, you seal your exam booklet back up. You don't seal your grid inside the booklet. You actually keep those separate. So the grids actually go into an envelope, and then the booklets go into a box, and then they overnight them back to the AAPC. If you wrote anything down on scratch paper, your shrink wrap, everything has to go back to them to make sure that you didn't, write down exam questions or something and you're trying to take them back to your house. If you're interested in the online exam, I have a video about that as well. Now, the difference with the online exam is you take it at a quiet spot of your own preference, probably your home. You can't have anything on your desk. You have to have, if you an external webcam, and if you also have a laptop webcam, you have to make sure that's disabled ahead of time. You'll log in, you'll talk with the proctor. They'll have you flip around your web camera and show them the entire room to make sure that you're not, trying to record yourself taking the exam or screenshotting anything, or that you don't have your cell phone handy. So you have to have a clear desk, you can have a beverage and your books, and that's about it. You are allowed a whiteboard, and I will talk about whiteboard tactics in just a little bit. Now, the exam itself is 150 questions, and out of that, in order to pass, you have to get 70% or 105 questions correct. For the in-person exam, it is one big session of 5 hours and 40 minutes. If you have an ADA, a disability claim, you can get an extension up to an hour of extra time for the in-person examination. Now, when you take breaks, though, anytime you take a break, the clock doesn't stop. So if you go to the bathroom for 10 minutes, you don't get an extra 10 minutes added on to the end. With the online exam, because they don't want you going out looking up answers, coming back, that's done in 2-hour blocks, and you cannot take breaks during those 2 blocks. Each block is 2 hours and 45 minutes each, so it's 75 questions and 75 questions to make up the total 150 questions. So technically it's 10 minutes less for the online exam, but you're not going to waste time filling in bubbles, plus you don't get breaks. Now, with the online exam, you fill your 75 questions up, you finish part 1. When you go to part 2, you can't go back to part 1. So there's also that as well. Once you're done with that one part, that's it. Now, whether you're taking it online or in person, each question has the exact same weight. So a 2-page operative report will have the exact same grade weight as a question about medical terminology. Now let's talk about exam breakdown, because that's going to be the same online or in person. Essentially, there's going to be 10 questions for each of the surgical sections of CPT, and then there's going to be 10 E&M questions. And I'm going to talk to you about those E&M changes in just a little bit. 8 questions for anesthesia, 10 radiology, 10 path and lab, 10 medicine, 8 med term, and remember, you are not allowed to bring a medical terminology book for the CPC exam. So if you have, for example, the AAPC edition of the ICD-10-CM book, though, make sure you're familiar with any kind of med-term anatomy sections in this book, because that will help you if you struggle with any of those types of questions, because you are going to have 8 med-term and 8 anatomy questions. You'll have 10 questions that are ICD-10-CM alone. Now, there are going to be ICD-10-CM questions in some of those CPT questions as well. It's going to be a mix of CPT and ICD-10-CM. Some of them might just be CPT, some of them are going to be mixed. And then there's really only 5 questions on HCPCS. So even if you're not great with HCPCS coding and you miss all 10, you could still pass the exam if you do well in other sections. And then there's going to be some questions that are just testing your knowledge of the coding guidelines. There's going to be 6 of those, and then 5 on compliance and regulatory issues. Now let's look at a couple of coding examples. So if we go to our slide deck, what is the ICD-10-CM code reported for chronic serous otitis media in the left ear? Now this one is just a diagnosis coding question, and I should probably note that you can skip around on the in-person exam. So if you want to just bang out all of those ICD-10-CM questions in MedTerm because you're really good with those and skip over those long operative reports, you can feel free to do that. With the online exam, you can go to the next question and go back. But again, once you're finished with part 1, you can't go back to part 1. Now, if we look at this exact question, A, B, C, and D, so all of them are going to have 4 options, you can see that they all have the same category. They all start with H65.2 something. So if we were even to just open up our ICD-10-CM book and go to that H65.20, we could probably narrow this down. And if we look at this question, look very interesting. So what is the one thing that we know about ICD-10-CM codes when we're talking about anatomies like the ear? That there's different codes for right, left, bilateral, unspecified. So if we're looking at this and we see, this was the left ear, that's one of the things that we're going to want to pick up. So go into your ICD-10-CM book and look at H65.2. That would be the first thing you would do, and narrow that down. Look to see what's the 0, the 2, the 1, the 3, and if you look at that, if you're going to waste time if you kind of look it up in the alphabetic index. You can do it that way, but if you just look at what the answers are first and kind of narrow it down from there, you can probably look right at that whole page of the H65.20 and go, these are all the same except this one is left and this is a left-sided question. Now, if you go into the alphabetic index and we're to do this, the proper way, the not just speeding it up for test purposes way, you go to otitis and then media, non-suppurative, and then otitis, media, non-suppurative, chronic, serous, and it'll take you to that H65.2, and then you need that fifth character for laterality. And in this case, that fifth character for laterality is the 2, which means it is the left side. So if it was me and I was taking this exam, I would look right at the answer to that H65.2, note that all of them are the same, and then I would go right into my ICD-10-CM book to that section and then pick out that is the left ear that I'm looking for. Now let's look at another case. This is a 38-year-old and presents with right-sided thoracic myofascial pain, a 25 gauge 1.5 inch needle on a 10 cubic centimeter controlled syringe with 0.25% bupivacaine was used. After negative aspiration, 2 cc's were injected into each trigger point. A total of 4 trigger points were injected. A total of 8 cubic centimeters of it was used on the rhomboid major, rhomboid minor, and levator scapular muscles. What CPT codes are reported for this service? Now, one of the things I'm going to tell you is, again, when you're getting these, look at these answers. They're all within a couple of digits of each other, which means that we can go right to that CPT book and look at what these codes are. And we can also look at the question itself, like what is it that they're asking us for? So don't even bother bringing out your ICD-10-CM book for this one because they're not asking you about ICD-10-CM. They're just looking for the CPT codes. And these are all within a couple of digits of each other, probably on the same page, if not maybe one's on the next page. So we can eliminate these by a couple of things. So when we're looking at these, we want to do a process of elimination. And the first thing I'm noticing is if we look at A, it's got 4 units. None of these others have 4 units. So if this is one that needs 4 units, that would mean that A is the correct answer. And then we have 20553, 20552, which sounds like they're pretty close together. And then we have this other one with a 51 modifier on it. So if this is something that is a modifier 51 exempt, if we look at 20553 and it's modifier 51 exempt, that's probably one that we can eliminate right as well too. So if we look like, let's do this. Let me get out my CPT book. So I get out my CPT book and the first thing I do is just flip to that page, and that's, let your fingers fly when you're taking the exam because time is super of the essence. Now, if we're looking at this in our book, so it looks like this one is a single tendon sheath, this one is multiple trigger points, and then this one is a single or multiple trigger points, 3 or more muscles. And that's what it looks like we were doing here. We were doing trigger point injections. And how many did we do? We did the rhomboid major, the rhomboid minor, and the levator scapular muscle. So that was 3. So let's look in our book here, and we have the one that is 3 or more. So we can see right away this 20553 is for the 3 or more trigger points, and that would be the code that we're looking for in our examination. So even if you were to go into your CPT index and look under injection trigger points, instead of going right to the code, it would tell you that. It would tell you for 3 or more muscle injections, you're to go to 20553. Codes for trigger points are actually coded by the number of muscles injected and not by how many injections were administered. Now here's another one, and this is like probably tiny if you're looking at it on a phone or a small tablet or something. And it's a big old operative report. Now this is one that you might initially look at and go, I'm going to skip this because this looks complicated and I don't want to have to read through this whole report. But go to the end here. What are they asking us? They are just looking for what CPT code is reported. And actually it looks like all of these answers are one single CPT code. So it's not like we're looking at multiple codes here. We're just looking at one single code. And if you look at the operative report, what are we seeing under the name of the procedure? We're doing a right breast reduction, a right graft, a left breast reduction, and a left graft. So right away, we can probably eliminate B and D because those aren't bilateral, and this looks like it was a bilateral procedure, unless there's something contradictory in the operative report. But it looks like, if we kind of scan through it, that this was a bilateral procedure, which means we're going to need that modifier 50 that's indicated in answers A and C. So right away, B and D are eliminated. Now, if you're taking the exam in person, you can just go ahead and write them off, like cross them off in your booklet, because you can write whatever you want in your booklet. If you're doing it online, it can be a little bit more difficult. So what I would do if I was taking it online is, in order to do the process of elimination, right at the top of your whiteboard, and I would not get like a crazy whiteboard. I wouldn't get one that's like, you know, the size of a wall or anything, but maybe nothing a little bit bigger than like a book. So I would write on here A, B, C, and D and keep that there. And as I am eliminating questions, I would maybe go, okay, it's not going to be B, and it's not going to be D. So I would know right away. And then maybe as I go through, I go, okay, it's not C, it's going to be A. And then right away, I'd only have to erase these three. Get one that has a eraser cap, because that can speed up some of your time doing that process of elimination. And then when you go on to your next question, maybe you can go, okay, I'm thinking it's A, it's definitely not C, and figure out like some symbols that you want to utilize in order to continue to use these same A, B, C, D without having to rewrite them every single time. Now again, if we look at this, we can see that codes A and C are right next to each other. They're very close. So right away, you're going to want to flip to that page that has the 19325 and the 19318 on it. So if we go to that page, we can see 19325 is a breast augmentation with implant. 19318 is a breast reduction. And if we look here, what happened here, this is a patient who had macromastia, they had neck pain, they had shoulder grooving, intertrigo, and we did a breast reduction. Now you might be questioning, oh yeah, it says there was a nipple graft in there. Now that's kind of included because when they do a breast reduction, they usually core out your nipple and relocate it after they've kind of moved the tissues back where they want them to be in a more cosmetic sort of reduced fashion, and that's included. So we're not going to look for an additional nipple graft, and clearly they're not looking for an additional code because every single answer only has one CPT. So in that case, we're just going to pick our code for our 19318, which is that breast reduction. So that didn't take nearly as long as you may have thought. And if you'd have wasted all that time reading through that report without actually looking, you know, what is it that they're looking for, it would have it would have taken you a lot more time. So when we go through, we can narrow it down and go, oh yeah, this was a breast reduction. It was bilateral. That's our 19318 code. And you know what? This wasn't as complicated as maybe at first glance it looked. Now on this question here, this is one where they're testing us about kind of our knowledge of the guidelines. 62-year-old male has a 1.5 by 2.5 centimeter non-small cell lung cancer in left upper lobe. The tumor is inoperable due to the severe respiratory conditions and comorbidities. During the encounter, During this encounter, the patient will receive stereotactic body radiation therapy under image guidance. Beans arranged in 8 fields will deliver 25 grays per fraction for 4 fractions. What CPT and ICD-10-CM codes are reported? Now, in this case, we're looking for CPT and ICD-10-CM codes. But look at, first off, our codes for C and D versus A and B. So if we look at A and B, you can see right there that C34.something is the first ICD-10-CM code there. And in C and D, Z51.0 is the first ICD-10-CM code. So if you're familiar with your coding guidelines, which you should be, because we want to be familiar with those coding guidelines, because the guideline, that's what they're testing you on a lot of times, is these guidelines. And if you know your guidelines, there's regulations regarding chemotherapy and radiation therapy. If you're not familiar with your guidelines, check out my series that I have specifically on the ICD-10-CM coding guidelines. But they basically say if the intent for the encounter is radiation therapy or chemotherapy, that there's a special Z code to use for those. So and that has to be primary, that has to be the first listed code. So we can right away eliminate A and B because neither of them have that Z51.0 code as the primary code. And now we're kind of narrowing it down. We're just looking at C and D. So we can just kind of block out the C35.11 and that Z51.0 because we know those are correct. When the only thing that's different between C and D here, if we're looking at these codes, is that the digits here are a little bit different. So we have 77373 and 77431. So again, look, they're not far apart. So go right to CPT, look up these codes and see what the difference is. So 77431, if we look that up in CPT, says it's radiation therapy management with complete course of therapy consisting of 1 or 2 fractions only. But how many fractions did we do? In this case, we did 4 fractions. So over here is 4 fractions. And that means that that can't be the right code either. So now we've eliminated A, B, and we've eliminated D because this is 4 fractions. This isn't right. So if we would go back and look at 77373, we can even verify from that it is the correct code for stereotactic body radiation not exceeding 5 fractions. So in this case, we're going to select our C code, and that would be the correct code for that one. And again, go and look at these answers right away. Like, look at what is different for some of them and kind of analyze the answers first before you even go and read the question. Now, this is the part that everyone's very curious about in E&M coding. Now, historically, when you would code office visits, they would give you the level of history, give you the level of exam, and give you the level of medical decision making. Based off of what I've seen in the practice materials, as well as the instructor test banks that are provided, they are not going to do that anymore. They are going to give you the note and they're going to have you figure out what that new level of medical decision making is in order to get the correct code or time. There may be some ones in there that are just based off of time. So everything except for office and outpatients is still going to go on history, exam, medical decision making. They may give you the levels. Some of them they might want you to score out. So you really do need to be a little bit more familiar with E&M for those 10 E&M questions. But for the office visits, what they're going to do is you're going to have to figure out now diagnoses numbers, the risks, and the data reviewed. So for those codes 99202 through 99215, there is a grid that will help instruct you to figure out the right level in your CPT book. So what I've done is I wrote in my E&M section to just see that grid on pages 16 and 17. Even though it's the right one page over, you might forget how to get there. So we're going to look at this case now and see what we can do as far as how are we going to code this out. So let's look at the answers first. We're looking at either a 99202, 03, 03 with a 99417, or a 99214. It's a 50-year-old female patient and returns to our office today with ongoing complaints of continued headaches. So we already know this is a returning patient. They've been to this office before, and what does that make them? An established patient. And these codes right here are new patient. So essentially right away, all these new patient codes are out. And we know it's going to be an established patient because this is the established patient code. But for just scoring sake, I want to go through some of this with you. You can eliminate it right away that way, but let's take a look at some of the other factors in here. So she has been having throbbing headaches, sensitivity in the anterior area. She's been taking 500 milligrams of Motrin, which is providing moderate amount of relief. She was referred to the endocrine clinic to deal with poor diabetes control. Review of labs reveals her last hemoglobin A1C was 10. We have some medical history, medications, a physical exam, which doesn't factor into our medical decision making really anymore. And then we have our impression and plan. So this patient has chronic headaches. For her headaches, we're going to prescribe Zonegran 200 milligrams. If this is not effective when she comes back in 2 months, we will consider other medications. And then we have diabetes. So when we're looking at our diagnoses, one of the first things that we have in medical decision making, and I'll bring out my big grid so we can kind of look at this together instead of looking at the CPT manual. So you need to figure out the number of problems, how much data are we looking at, and the risk of the patient. So how many chronic problems do we have here? 2. We have 2 problems. Both of them are chronic. They're not acute problems. So right away, we're right here with our 2 or more stable chronic illnesses. We didn't really review a lot of data. It says here, they reviewed some labs. So we get maybe 1 point here for reviewing a lab. And then in our risk, We did some prescription drug management. So that would put us, we only need 2 out of the 3 in this column. That puts us at a level 4 visit, which would be our 99214. What I would do is, if you are taking the exam in person, use your grid. You can kind of write things down on there. What I would maybe do with the online is write maybe your little columns here. So here's your diagnoses, here's your data and risk, and then as you're going through, write down, figure out your path for what you want to do here. Like, do you want to have your number of diagnoses or treatment options and say, okay, so M for moderate, and then M for moderate, and risk maybe is, L for low, something like that. And that way, when you have these written down, you can kind of correlate them on the grid and go, okay, it was moderate, moderate, low. Go through each column, I would say, first, and figure out first, what is our level of diagnoses, what is our level of labs, what is our level of risk, and then combine them all together. And then don't forget your new versus established, because if it's a new patient to the clinic, it's a 99204. If it is an established patient, 99214. And if you struggle with E&M, get some additional education in there. I have a course that you can take. I'll link it below. There's also some E&M education that I have for the non-outpatient stuff that you can look over, that does the history exam, medical decision making, and how to get those levels. So you can get that resource for free as well. So yeah, there's going to be some codes on emergency department. There's probably going to be some inpatient codes, some consultations. And as long as you can figure out history, exam, medical decision-making levels on those, and that's all in the playlist that I have previously, you can figure out basically any level of service to piece those together. Just make sure you pay attention to that setting. If it says emergency department, you're going to look for an emergency department code. So that one, even just based off of the fact that this was an established patient and not a new, we know this is a 99214, but I showed you how to kind of level through it a little bit as well. As you get familiar with that E&M grid, you'll start picking up some things that you can draw out of really quick, like that prescription drug management section. Now, if you have questions about what you can and cannot bring to the exam, check out the AAPC website, aapc.com/certification.faqs.aspx, because that will answer questions for you about what you're allowed to bring to the exam, what books you can bring, what you can and can't write in your book. And I will link below also the approved resources document, so you can see where it specifically says, you can bring in the AMA edition of CPT and then any edition of ICD-10-CM and HCPCS, because that is available on the AAPC website. So check in the description, I'll link that as well. So when you're going through this exam, look at the answers first, see what it is that they're really asking you, because you don't want to spend 5 minutes, 10 minutes looking through a note trying to figure out what the heck's going on, when maybe all they're asking you for is a simple diagnosis, and you can do a process of elimination to go through them pretty quickly. Pay attention to things like if this needs a 50 modifier or not, because if there's one that has a 50 modifier and it needs a 50 modifier, you can take those right off. Pay attention to if it's 51 modifier exempt. And a lot of times, like I said, a lot of the codes are just 1 or 2 pages away. So go to that page in your CPT book first. Don't look it up in the alphabetic index like you do in kind of traditional coding. In exam mode, you go right to the answer and look at those. That's what I did with my exam. My fingers just flew. I looked at the answers, and if it said 9921, that's where the section I flipped to right away. And pay attention to that sequencing. Look at that cancer code that we looked at, where we know right away that chemotherapy has to be that first listed diagnosis. And we can eliminate right away 2 of the answers just based off of knowing that guideline. If you come across a question that is not your strong suit and you're looking at this and it's like a 3-page thing and you're like, oh my gosh, it'll take me forever to read through this and figure this all out, skip it, because it has the exact same weight as every other question on the exam. But make sure you answer every single question. Don't ever leave anything unanswered. If you're in person and they say we have 5 minutes left, start filling things in, because if you fill something in, you have at least a 1 in 4 chance of getting it right. If you don't fill in anything, you're automatically going to get it wrong. So I hope this video helped you feel more comfortable about taking the CPC exam. If you take the CPC exam and you wind up doing really well and you think it was because this video helped, please comment below and let me know, because I love hearing that kind of commentary. And if you found this video helpful, I'd really appreciate it if you give it a thumbs up. Don't forget to subscribe and hit that notification bell so you can get alerts when I post new episodes. And if you share this video with your friends who are taking the CPC exam as well, that also helps me, because it boosts this up in the algorithm so that people that are searching for tips on how to pass the CPC exam can find this very helpful video first. I will see you in the next video, and until then, just keep on coding on.